Well, the medical community seems to be split by the great Lyme disease debate. Now, how is Lyme disease defined? Is Lyme disease chronic? Do long-term antibiotics work? Is it congenital, passed from mother to child? Is it sexually transmitted? Is Lyme disease the next epidemic after AIDS? Well, we're going to try and answer all those questions, and here to help us while also defending each side of this heated debate are Dr. Paul Auerter, a professor and clinical director of the Division of Infectious Diseases at Johns Hopkins University School of Medicine, who believes that chronic Lyme disease does not exist. And he's joining us via Polycom. And Dr. Shitra Bhakta, who specializes in autoimmune disorders and is also the head of the OC Integrative Medical Center in Southern California. She believes chronic Lyme disease does exist. Dr. Auerter, let me talk to you first. You believe that Lyme disease is a real syndrome. You're talking about chronic Lyme disease that you question.
What's really the debate about today, I think, is the label of chronic Lyme disease, which means that there's an infection that persists despite antibiotics and requires long-term antibiotics for cure. But many of the patients that come into my office, and I see many of them that have similar difficult stories, they're angry, they're frustrated, and I think many are looking for an answer. And what has happened is chronic Lyme disease has become a label to help explain these chronic problems. But what we know from clinical studies, at least 4 trials that have found that antibiotics have worked no better than placebo for helping many of these symptoms.
All right, Dr. Shitra Bhakta, does this chronic syndrome exist or does it not?
It does exist.
Okay, and you have many that say don't, and even doctors are losing their license for treating this disease with long-term antibiotics.
But, just to allude to where he said the NIH showed that the long-term antibiotics did not help, there was the monkey trial, and they actually autopsied monkeys after treating them with 90 days of antibiotics, and they found that in 70% of these monkeys, the Lyme spirochete was still persisting. So there is chronic Lyme.
Okay, Dr. Auerter, I'll ask you to respond to that. Is it something that is organically based, or are you suggesting that these patients are showing psychosomatic or somatoform symptoms?
The label here is chronic Lyme disease, but what's important is people have looked very hard, many researchers in humans, and cannot find evidence of infection. And the other key point, again, is there's no durable benefit with long-term antibiotics that's been tried. I, as a physician, only want to give what's best for my patients. Why would I give treatment that doesn't work?
Brooke, what do you want to say? You're shaking your head.
Oh, where do I begin? I'm walking evidence that long-term antibiotics, it brought me my hearing back, it brought me my sight back, my heart arrhythmia stopped, palpitations. I was 30 pounds less than I am now, and I'm already too thin. I had short-term memory problems where I couldn't remember the names of my family, my friends, and a placebo, I'm very sorry, but a sugar pill would not have helped me. And long-term antibiotics from a doctor who is a Lyme literate doctor and specializes in this disease was able to systematically knock back this disease.
Kathy, you wound up in a hospital.
Oh my God, I wound up in a hospital. I had a mini seizure. I told it my heart breaks for you, okay? Because I was dehydrated and collapsed out of the bed. And my blood pressure was 60/20, and I thought I was going to die that day when I asked them in the hospital if I was going to make it through the day. And they said, well, we'll see, okay? Listen, I'm better now. I'm 30 pounds lighter. I have my energy back. I mean, how do you explain that? I'm on long-term antibiotics.
And Dr. Beat, as you referred to her, was your treating physician.
Yeah, she is my doctor. I mean, she is...
Could I just interject? I don't do all this voodoo medicine with hyperbarics or anything of that sort. I'm basically a mainstream doctor who has a patient coming in and saying, look, those treatment guidelines that you treated me with are not working. And then I have to make a decision where I need to help these patients.
All right, well, we're just out of time. We're just going to have to stop. Dr. Auerter, thank you so much. I appreciate you weighing in on this. Dr. B, we've seen Kathy get so much better under your care and direction, and I know that this is very expensive and a very difficult problem. We have asked Dr. B if she would be willing to help you pro bono and provide you the guidance and care, and she has said that she would. So we'll get you that help. We'll be right back.